We begin tonight talking about your health. Joining us is Dr. Jessica Lee, an internal medicine physician at the University of Maryland Medical Center and assistant professor at the University of Maryland School of Medicine. Doctor, thank you for joining us.
Thank you for having me.
Happy New Year, if it's not too late to say that.
Never. Happy New Year to you.
And we're in January, so it's perfect time to talk about health resolutions, health trends. What should everybody be thinking about right now?
For me, for 2026, I think we should be thinking more about wellness. I think we all get so fixated with what everyone is doing to be well that we have to match that, whether that's increasing certain foods, exercising more, almost making it a competition, when instead I really want to tell people to listen to their bodies. You can actually rest if you're on your health streak for the year. God forbid, you can actually rest a few days a week instead of working out 7 days per week. And then listening to your body, feeding it, meeting the needs that you have for the exercise routine that you're starting in 2026, different things like that.
A little bit of peer pressure is good.
Definitely. I think, you and I were talking just before this about you and your wife going on a walk. I think things like that are nice, sort of like the familial, friendly competition. And then, my best friend and I, we actually do try to be like, did you walk today? How much did you walk? Just to make sure that we're both moving, but in a friendly way. Nothing that's like, well, I got 2,000 steps. Did you get 2,500? Is it time for me to add more steps?
So that's like an exercise buddy. That's
exactly.
a good thing.
Yep, definitely. And I think finding someone that supports you but doesn't, I don't want to say diminish you, but feel like that you always have to be pushing yourself too hard, working through a new injury, like accidentally spraining your ankle or something and thinking you have to keep going to the gym or things like that. Somebody who's like, take the rest, or we can modify our workouts today to do yoga instead of the walk, things like that.
I think some of these things are like group activities, like the idea of a dry January.
Yep.
Cutting out alcohol. It tends to be groups of people more than individuals.
And I think it helps. It's so funny that you bring that up, because I was actually just at a work gathering last week where 3 people were saying that they were trying to do dry January. Someone brought sparkling cider instead of the bottle of wine to help support that. And we were just talking about finding different ways to improve your health and wellness. And I think they felt really glad to find someone else like, oh, I didn't realize you were doing dry January either. So having that camaraderie was like, great, we can both be the people drinking cider and not the beer today, and that's fine.
It's an interesting trend, because it's not people saying, I'm never going to have a beer again. It's maybe a matter of exercising some self-control to prove you can do it. And actually, truthfully, you couldn't do a dry December for a lot of people because there's so many social events.
Exactly. And I think that's the thing too, is both realizing that you can limit yourself and also trying to find the reasons, why you're even trying to do it. Is it that you felt like you overindulged in December? Is it that you actually don't like how you feel after drinking 3 drinks versus 1, things like that? So I think it also offers insight in realizing, what you're doing to improve your health overall, like I said, or like you said, actually, not doing things to compete for yourself, but also realizing that it's okay to do less, and it's okay to listen to your body and take it slow.
I see that on doctor's office questionnaires all the time. Do you consider yourself a social drinker? Are you somebody who never drinks alcohol? Do you have more than 2 drinks a day, something like that? What is the provider looking for there?
It's really we really try to do on the updated screening specific drink numbers, because I think when we label it as social, everyone, people say that to me all the time when I have new patients. And I was like, but what does that look like? Like, are you drinking 2 drinks in a social setting? Or are you drinking 4 to 6? So it's really, when we ask that, it's to open the door for discussion, to get a sense of, okay, it's fine if you're a social drinker, but truthfully, binge drinking is gender-based, and it's 4 drinks for a woman and 6 drinks for a man. So it's for us to figure out, okay, if you're only drinking on weekends, but if you're drinking 6 beers on the weekend, that is technically binge drinking, and for us to talk about healthier habits.
Where does the discussion go when you're talking about healthier habits? When you want to gently suggest that somebody dial it back a little bit, or probe to find out if maybe, they've lost control of it?
I honestly try to be a human before anything else, which feels, very easy and basic, but I'm just like, I love to eat French fries. I would never tell patients to give up French fries. But if you're eating takeout 5 days a week and you have high blood pressure, and that's probably contributing to some of those bad numbers, talking to them about saying, if you can't do less fast food because of how your job works or your schedule works, could I offer doing the salad or doing the wrap instead of the fries? Just finding ways to make easy adjustments, because I think so much of us feel like it's got to be all or nothing. Like, I'm going to lose 20 pounds cutting out all carbs. And then the second you have your first baked potato, it's like, oh, all 15 pounds came back. I don't know how that happened. So I'm never someone to say, get rid of it all. It's truly, truly moderation, and figuring out what moderation for you looks like, whether that's one serving of French fries a week down from 5, or, having that one beer instead of 3.
How do you advise patients who maybe it's a January visit, setting some goals for the year, and they say, based on your numbers, I need to lose 20 pounds, and I want to do that. What's your advice?
I tell them what I've been saying all this whole day and this whole program, which I really, really believe is to just take it slow. I tell them, just take a 10-minute walk today. I know you have 10 minutes. I know you're on your phone for 10 minutes. You're taking a potty break for 10 minutes. You have 10 minutes. Just take that walk. Unfortunately, none of us are 21 anymore, so you can't just run a mile today and lose those pounds. You have to be gentle and listen to your body. So that's what I tell them. I said, I just want you to walk 10 minutes every day this week. If you can, make certain diet adjustments, but setting realistic goals, because I think so many of us feel totally thrown off the diet the one day we're off, right? Like you went out to eat, you couldn't stop yourself at that happy hour, and you're like, well, the day's gone. Let me just finish eating all the crap I want to eat and start over tomorrow. But realizing that you can. It's okay to start over tomorrow, start fresh. And so I really just try to tell them, let's do 20 pounds, but realistically, over the next 6 months to 1 year. If you come back in 2 months and you are 20 pounds lighter, I will love that for you, but I really want that to be sustainable.
Yeah, the problem with the take it slow approach is after you've lost 5, the motivation dissipates. I mean, nobody's better at losing 5 pounds than I am. I've done it 5,000 times.
You're great at it. You're an
expert. And then you just sort of lose interest in that baked potato or whatever starts looking better.
It does, and I think what it is realizing that, and what the starting slow can do for you is hopefully some of the healthier habits have started, and that looks like you said, eating less, maybe limiting the amount of carbs or limiting the amount of alcohol, and then trying to use that as momentum. And then other ways that exist, I also tell patients, and if the weather's cold like it is now and you can't do your usual walk, go on YouTube. There are tons of exercise videos for, again, 10 minutes to start, 15 minutes, just something different to motivate you.
Couple of trends we're noticing. Back to fast food, I think Chipotle is advertising a high protein menu, which I think just means another scoop of chicken or whatever. But why all this focus on protein?
Protein is a natural building block for all of us for building muscle. And because what a lot of patients and people I don't think realize is that we think that by cutting out all these carbs and foods and limiting our calories, we're burning fat. You actually burn muscle first before you lose the fat. So that's why exercising while losing weight is so important, to maintain your muscle mass. And proteins are the building block for that. And the other nice thing about proteins nutrition-wise is they offer higher protein content. They make you feel fuller faster, and then they usually tend to have less calories. So it sort of meets everyone's sort of dietary goals that they need to help them lose weight by hitting your protein for the muscle building, but also making you feel fuller faster.
The GLP-1 drugs that everybody's seen advertised in any football game you've watched this month, last, or next month. There's some news. I mean, they're coming out with a pill version, and there was some new data that when you stop these meds, the weight comes back for almost everybody.
It does.
Your thoughts?
I think it's a great medication. I've been prescribing it. I'm not a weight management specialist, but it's become so ubiquitous in healthcare now that all of us are doing it, from surgeons to internists. It's even been approved as young as, I think, age 12 for kids. It's a fantastic medication that works, and it does a lot too. There's been so much additional studies coming out showing it can help with addiction pathways. So if you have smoking or alcohol addictions, it can help lower those. They're great medications, but I also tell my patients that, if you want to start it, I think you're most likely a great candidate for it for XYZ, but you will lose the weight, you will gain the weight back if you ever stop the medication. So we talk about a game plan of using what the GLP-1 teaches you, which is better portion sizes, hopefully overall healthier habits, and then getting to that point where if we're going to take them off, either weaning or deciding if they stay on it long term. But yeah, it is a true discussion you have to have with patients that it could be a lifelong medication, or if we do stop you, there will be some weight gain, and acknowledging that we have to meet those healthy habits that we've been talking about this whole program to help keep the weight off.
How much are you able to focus on preventative medicine as a practitioner with a lot of things on your plate? Maybe the patient comes in with some urgent or semi-urgent concern. Where do you think you can help in an average clinic appointment?
That's such a great question. I actually work in sort of like an acute clinic Monday mornings, teaching residents and things like that. And we talk about that a lot, about finding that balance of they probably have a broken ankle, so we should deal with that today. Like today is not the day to discuss the patient's mammogram and prostate screening. But if we haven't seen them in a while and they are coming in with an acute complaint, meaning like, oh, I've had this shoulder injury for 2 months, yep, we'll order your x-ray, but also if you're here, the lab's here, can we just get your regular cholesterol screening, diabetes screening? Because unfortunately, a lot of the cancer screenings and other preventative screenings take additional appointments, right? Like colonoscopies, mammograms, but we try to do as much as we can in that moment with vaccines and then with any labs that help us identify chronic medical problems.
This time of year, it's dark and it's cold. And we were talking about going outside for a walk. Yeah, you can bundle up and do it. It's a great idea if it's not icy out. But a lot of people have trouble this time of year. I mean, the seasonal affective disorder, the winter blues. How does that fit into the realm of things we can attack in just a couple of sentences?
Seasonal affective disorder is very real. I realized I had it in medical school when I was documenting it every year in my little blog I kept, and I was like, wait a minute, this is the 3rd year that I've written about this.
Might be a trend.
It might be a trend. And it's little things like, honestly, like you said, even if you can't go outside when it's cold, even standing near a window, people buy vitamin D lights, but honestly, just getting to a window to see the sunshine helps wake you up and helps honestly improve your mood too.
Good place to end it, Dr. Jessica Lee. Appreciate your time.
Thank
you very much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.